නිවසේ මෙවැනි මතු පිට රැඳෙන විස බීජ 99.9%ක්ම විනාශ කරන විම් ක්ලීනර්ස්.
Tonight, no room to relax. 14 more Delta variant infections confirmed. The Health Ministry tracing some of the infected. Meanwhile, the target in the first phase of vaccinations in the Western Province achieved.
Now we will be embarking on another target where those who are above third will be targeted in the Western Province.
Worth the wait. The World Health Organization upbeat about recent study which increases the time between the two doses of the AstraZeneca jab.
Up to 10 months of a gap between the first and the second dose of the Oxford AstraZeneca vaccine still provided very good immunogenicity.
Timing matters. As nurses' trade unions back down, 3 other factions, including the PHIs, revert to trade union action over payments and promotions. All that and much more coming up on First at 9, this Saturday, the 3rd of July, 2021.
Pocket ticket fit when a new Axe ticket perfume.
From AdaDerana, this is AdaDerana First at 9. Live from Studio 24 in Colombo.
Good evening and welcome to First at 9. I'm Dhammike Kanai. Now, the entire country had been on tenterhooks to learn whether there are more Delta variant COVID infections in Sri Lanka other than the 5 which were detected from Dematagoda. Today, they got their answer. There isn't just 1 or 2, but 14 of them. With that being the case, health experts also warn that people who are not vaccinated or only have received the first dose of the vaccine are more likely to contract the deadly variant.
Currently, health officials across the world are challenged by the growing need to treat the influx of COVID-19 patients to hospitals due to the emergence of more virulent and deadly strains of the virus. This requirement places the need for vaccinations at the top of the list of priorities more than ever, especially those who are over the age of 60. Director of the Department of Immunology and Molecular Medicine at the University of Sri Jayawardhanapura, Professor Chandima Jeevandara emphasizes that people who have either not received the COVID-19 vaccine or have just received 1 dose are more likely to contract the Delta variant. As such, he stated that until the majority of the population is vaccinated, it is imperative that the health and safety measures are adhered to by the general population. These words of caution are more important now after the Ministry of Health confirmed 14 more cases of the Delta variant in the country. This is in addition to the 5 initial cases of the variant confirmed from Dematagoda. Deputy Director General of Education and Research at the Ministry of Health, Dr. Hemantha Herath, stated that some of the 14 samples had been collected within the Colombo municipality, while some had been sent from the National Institute of Mental Health, the Karapitiya Hospital, and a private hospital in Maharagama. He further stated that the epidemiology unit is in the process of tracing these patients. Given the latest development, the Health Ministry announced today that the vaccination program is being conducted at full speed and in an orderly manner as they successfully completed the first phase of the immunization program in the Western Province yesterday.
We have already concluded 1 phase of the Western Province immunization program where those who are above 60 to be vaccinated by Friday yesterday, and we can firmly say that we have achieved that target, and the majority of the people who are supposed to get this vaccine has already got this vaccine. Now we will be embarking on another target where those who are above 30, everybody who are above 30 will be targeted in the Western Province as the next phase of activity, so that the areas with highest risk will be covered in this manner, so that all the eligible people in the Western Province will be immunized by the end of July. In addition to that, the consignments that we are receiving from time to time will be distributed in other districts as well. At this moment, in other districts other than the Western Province, it will be targeted for those who are above 60, and this will be expanded to other groups also once the stocks come, as well as once we complete the targeted areas in the Western Province.
He further said that since the go-ahead has been granted to administer the Pfizer and Moderna vaccines in place of the second dose of the AstraZeneca jab, this will be looked into immediately.
We are expecting a consignment of AstraZeneca vaccine in the coming days, probably during the course of this month, and this will be distributed among those who have got the first dose, especially above 60 years of age. And also the Advisory Committee on Communicable Disease has already given their recommendations to immunize those who got the first dose of AstraZeneca with other vaccines such as Moderna and Pfizer. As and when these vaccines come, those who have got the first dose of AstraZeneca also will be given a second dose from those vaccines in future.
In the meantime, a new study has found that the Oxford AstraZeneca vaccine is still highly effective, even if the two doses are administered 10 months apart. It bears good news for Sri Lanka, as some 600,000 people are awaiting the second dose of the AstraZeneca jab, and some have been awaiting for over 12 weeks. The initially prescribed waiting period for the second dose is administered.
We saw that report showing that up to 10 months of a gap between the first and the second dose of the Oxford AstraZeneca vaccine still provided very good immunogenicity after the second dose and had resulted in high levels of neutralizing antibodies. It is very reassuring, I think, for people and for countries where there may be a delay in obtaining the second dose. We know there are supply constraints, and many countries that have given the first dose to people do not have supplies for the second dose. COVAX is trying to address that. But in the meantime, it's reassuring that a longer gap beyond the 8 to 12 weeks that is currently recommended by WHO is, we're not going to pay a penalty for that. People will still mount a good immune response.
Meanwhile, on the government's plan to reopen some schools, Dr. Hemant Herath at the Ministry of Health said that the ministry is in talks with the Ministry of Education to chart a way forward.
There is a move to open the schools in different ways and different stages, and the Health Ministry is constantly in dialogue with the Ministry of Education, and the appropriate guidelines and other required conditions are reviewed at this moment, and probably within the coming days there will be guidelines and other conditions published, and the plan of the reopening of schools will be declared. But at this moment, I think it is very important for all the parents and the children to adhere to the current health guidelines and wait until a proper plan is declared and guidelines are issued.
In the meantime, the country's overall number of persons to have recovered from the novel coronavirus rose by 1,853 today, taking the island's tally to 231,394. As for the active COVID-19 cases, health authorities placed the number of new infections confirmed today at 1,010, thus raising the figure to 29,254.
අද සේවසකට වැඩි ජනතා විශ්වාසය නව සංයෝගයක රයිනෝ රූෆින් සහ සීලිං ෂීට්.
Now, Director General of the World Health Organization, Dr. Tedros Ghebreyesus, warns that no country is out of the woods yet in terms of the dangers of COVID-19, especially with the evolving Delta variant, requiring constant evaluation and careful adjustment of the public health response. Addressing a media briefing, he also cautioned against some countries issuing vaccine certificates, which he says might discriminate against certain people and countries using a particular variety of the jab.
Compounded by more transmissible variants like Delta, which is quickly becoming the dominant strain in many countries, we're in a very dangerous period of this pandemic. In those countries with low vaccination coverage, terrible scenes of hospitals overflowing are again becoming the norm. But no country on earth is out of the woods yet. The Delta variant is dangerous and is continuing to evolve and mutate, which requires constant evaluation and careful adjustment of the public health response. Delta has been detected in at least 98 countries and is spreading quickly in countries with low and high vaccination coverage. There are essentially two ways for countries to push back against new surges: public health and social measures like strong surveillance, strategic testing, early case detection, isolation and clinical care remain critical, as well as masking, physical distance, avoiding crowded places, and keeping indoor areas well ventilated are the basis for the response. And second, the world must equitably share protective gear oxygen, tests, treatments, and vaccines. I have urged leaders across the world to work together to ensure that by this time next year, 70% of all people in every country are vaccinated. This is the best way to slow the pandemic, save lives, drive a truly global economic recovery, and along the way, prevent further dangerous variants from getting the upper hand. By the end of this September, we're calling on leaders to vaccinate at least 10% of people in all countries. This would protect health workers and those at most risk, effectively ending the acute stage of the pandemic and saving a lot of lives.
On the topic of issuing vaccine certificates, the WHO chief says it runs a risk of discrimination against certain people and countries which have used a particular variety of vaccine against COVID. The European Union's vaccine passport program has approved only 4 vaccines: Vaxzevria of Oxford AstraZeneca, Comirnaty of Pfizer-BioNTech, Spikevax of Moderna, and Janssen of the Johnson & Johnson vaccine.
Some countries, regions have launched so-called vaccine certificates, and I want to make it very clear that it's important that these do not lead to discrimination against those people and countries that have either a lack of vaccines or certain type of vaccine. As you know, WHO issues emergency use listings for vaccines based on a stringent assessment of safety and efficacy. And we expect all countries to recognize and accept those vaccines that WHO has approved.
Big 3.
For some time now, it had been understood that the people's behavior will chart the future course of the pandemic, and as such, global as well as local calls have been intense in that regard. Visuals of how the Delta variant overran India with its health system brought to the brink of collapse was carried by media, where that should have spurred caution and respect towards COVID-19 for the harm it is capable of causing to a country. In Sri Lanka, none of it is felt.
It is more than evident that the COVID-19 pandemic has crippled every country it infiltrated, putting millions of people out of jobs and pushing economies to the verge of collapsing world over. It is also been clear for quite some time that the cause of the pandemic depended on the human behavior. Where people were diligent in embracing recommended public health practices such as face mask wearing and social distancing, the pandemic subsided. Where people failed in that regard, the pandemic consumed. Conventional media and social media have been getting that message across to the people in Sri Lanka on a daily basis. But there are still those who seem to be ignorant to the dangers caused by COVID-19. This ignorance could not have been more evident at the Palyagoda Fish Market and the New Manning Market.
Sri Lanka police are conducting constant quarantine operations across the country. Yesterday, we have arrested 563 suspects in connection with the offences of face mask, social distancing and violation of quarantine rules and regulations. Total number of 46,823 suspects have been arrested in connection with same offences. In addition to that, we have implemented 14 roadblocks at the exit and entry points of Western Province.
Meanwhile, another bus which violated the inter-provincial travel restrictions was taken into custody by police today. The bus plying from VAVUNIYA to Colombo came under police scrutiny in MEDAWACCHIYA. The driver and the conductor of the bus were arrested and they are due to be produced before court. Meanwhile, in NUWARA, 15 people have been arrested by the police for conducting a meeting at a private insurance company, despite the guideline issued by the Director General of Health Services clearly advising that meetings at both private and state entities are limited to 10 persons, provided the gathering is essential. Subsequently, after being produced before court, they were released on bail and were directed to a 14-day mandatory quarantine. In the meantime, more areas across 3 districts entered into a state of isolation with effect from 6 a.m. today. Accordingly, the Nayaru Fisheries area of the Gramaniladari division of Chemmala East, that comes under the jurisdiction of the Nayaru police area in the Mullaitivu district, was isolated until further notice. In the Kegol district, the Madeyava village of the Mihipitiya Gramaniladari division was also placed under isolation. The Gramaniladari division of Marudamune 3 in Ampara district too was placed under isolation today. Meanwhile, 2 Gramaniladari divisions in 2 districts were brought out of isolation today. Halamada Grama Niladhari division of the Kegol district as well as the Vilgoda village of the Iluppugedara Grama Niladhari division of the Kurunagala district were freed from isolation.
At a time when the need for medical care and public health services are felt more than ever as the country is engulfed in a pandemic situation, the Interim Medical Services United Front, which includes the Public Health Inspectors Union, also launched a strike this morning. It is noteworthy that none of their demands are related to the current pandemic situation, but instead, the concerns raised are related to payments and promotions.
The Public Service United Nurses Union, Government Nursing Officers Association and the Old Ceylon Nurses Association launched an island-wide trade union action on Thursday over unmet demands, bringing operations at main hospitals to a standstill. However, yesterday a discussion was arranged between the President and these nurses' unions, during which the head of state agreed to 5 of the demands. Accordingly, the President agreed to the opening of a University of Nursing, the reinstatement of staff status which was suspended during the previous government via Circular 32/2017. The head of state also assured the reinstatement of the mechanism to promote Grade 3 nurses to Grade 2 in 5 years and Grade 2 nurses to Grade 1 in 7 years, as well as the 20,000 rupee annual uniform allowance. The President also agreed to refer the proposal to consider the current 36-hour working hours as 30 hours equivalent to 5 days a week to a special committee. The remaining 2 demands, which are the 10,000 rupee allowance and an additional service allowance of 1/100th of the basic salary, were agreed to be provided during the upcoming budget. Accordingly, the nurses' unions called off the strike and joined duty at 7 this morning. Most notable, none of their demands are related to the present pandemic situation. Meanwhile, before the operations at hospitals across the country return to normalcy, the Interim Medical Services United Front, which includes the Public Health Inspectors Union, launched a token strike at 8 a.m. today. They complained that promotions approved just for the nursing services is unfair by the 13 professions supplementary to medical and paramedics in the health service.
විශේෂයෙන්ම මේ හෙද සංගම් තුන වෘත්තීය සමිති ක්‍රියාමාර්ගයේ නියුණු ඉල්ලීම් අතර පොදුවේ පරිපූර්ණක සහ අතුරු වෛද්‍ය සේවා වෘත්තීන් සියල්ලටම බලපාන්නා වූ වෘත්තීය ගැටලු තිබුණා. අපි බලාපොරොත්තු වුණේ නැහැ සෞඛ්‍ය අමාත්‍යාංශය හෝ ජනාධිපතිවරයා මේ වෘත්තීය ඉල්ලීම් ඉටු කිරීමේදී අනිකුත් වෘත්තීන් වල සමබරතාවය ගිලිහෙන විදිහට මේ ඉල්ලීම් ඉටු කරයි කියලා. මේ සියල්ලම සලකා බලලා අපි ඊයේ දින රාත්‍රියේදී ශ්‍රී ලංකා මහජන සෞඛ්‍ය පරිශෝධනගේ සංගමේ විධායක සභාවත් ඒ වගේම අතුරු වෛද්‍ය සේවා ඒකාබද්ධ පෙරමුණේ විධායක සභාවත් ඒ පරිපූර්ණක සහ අතුරු වෛද්‍ය සේවා ඒකාබද්ධ බල මණ්ඩලයේ විධායක සභාවත් සියලුම රාජකාරිවල නිවත් වී සිටින්න තීරණය කරා. ඒ වගේම සඳුදා දිනේ ඉඳලා අඛණ්ඩ වැඩ වර්ජනයක් කරා යන්නත් තීරණය කරා.
Health services across the country, including laboratory activities and services pertaining to public health, were disrupted by the move. The strike also affected the vaccination program, and at some locations, jabs were administered with the intervention of health officers of the Sri Lanka Army.
Today's COVID-19 caseload, meanwhile, has now risen to 1,251. See you shortly.
ගෙදරකට තේ හදනවා කියන්නේ වෙනම වැඩක්. මැලිබන් තේ ගෙදර පදමට තේ.
Welcome back. You're watching First at 9. Now, a total of 26 individuals have been arrested so far over an incident where a 15-year-old girl had been sold online for prostitution. Police media spokesperson Senior DIG Ajit Rohana said that more are due to be arrested as per the investigations. 26 arrested individuals are persons who had molested the minor, while the remaining are those who sold and transported the girl. The police said that among the arrestees is the mother of the child and the person who created the online advertisement. Reportedly, among 4 individuals arrested on Thursday are a captain of a ship, his assistant and a gem merchant. An arrest has also been made last night. Details of more individuals had been revealed when inspecting the mobile phone of the girl. The incident came to light during an investigation into a person arrested in Mount Lavinia on the 7th of June. Welcome back. You're watching First at 9. Now, if leniency is given to players to get away scot-free from disciplinary violations without any action, it sends the wrong message. Former cricketer Avishka Gunawardena made these remarks today in light of the recent incident in Durham involving 3 of Sri Lanka's national cricketers, including the team's vice-captain.
Cricket, a sport adorned by the Sri Lankan people to the point that even those who may look from the outside might think it to be the national sport of the island. Ever since the tiny island lifted the ICC Cricket Cup in 1996, the entirety of Sri Lanka has been cheering the team on every juncture so it could hit similar heights. Though the cheers have gotten louder, the performance on the players' part, however, have been waning, and cricket in the country looks to have hit rock bottom. If the on-field performances weren't bad enough, the discipline of players, an area the national side had a decent record in the past, looks to be diminishing. The scenes from Durham in England on the 27th of last month was both sickening and embarrassing. 3 national players, including the team's vice-captain, violated the discipline record and violated the bio-bubble, putting the teammates and the rest of the tour in jeopardy. To make the matters worse, it was right after the 3-0 drubbing they received at the hand of England a few hours earlier. The 1996 World Cup winning captain Arjuna Ranatunga had harsh words and said that during this time, the errant players may have even received a good slap, adding that the sole focus of the players in his generation was giving their best and nothing else. Speaking to First and 9, another former cricketer, Avishka Gunawardena, also commented on the diminishing state of discipline within the Sri Lankan cricket team.
I think it's not fair to compare generations. The game kept changing. Everything keeps changing, and then now there's social media, there's a lot of access to internet and other information. But I think it comes down to the responsibility of the players. Everyone has to take responsibility. Everyone has to be accountable for what they do. And I think everything starts from home. We talk about discipline. It starts from home. It's education, how you've been brought up, your family background, all these things matter. Now these days everyone is in a bubble and you have to be really mentally tough to be confined into a room, to be confined into a hotel, and to be tough enough to basically go out there and play cricket. Some are used to going out, some used to watch cricket to pass time and relax. Some like to with the teammates and talk cricket or talk something else, or maybe play a game of cards or something to relax. It's not easy to stay in a bubble for a few weeks, but obviously you have to be mentally tough to go out there and play cricket also. So that's one side I see. If you're talking about discipline and if you're talking about a particular incident, that's one of the sides that I see. I think we've seen probably the same players, probably a few other players getting away with here and there with disciplinary things, not getting punished or whatever, just getting away scot-free, if I might say. So then you create an environment or you give a message as to, okay, you might be able to get away with doing something that you shouldn't have done. And the moment that creeps into your mind, that becomes an issue.
And that's it from all of us here at First at 9. Thanks for watching. Bye-bye.